Our next witness, Jodie Wang. Good morning.
Good
You
morning.
have up to 6 minutes, and if you could please state your name for the official record as you begin.
Good, thank you. Good morning. My name is Dr. Jodie Wang. I am a family doctor from Kitchener. I've recently been elected to the Council of the Ontario Medical Association, and I'm also a member of the grassroots groups Concerned Ontario Doctors and Doctors for Justice. These groups, along with the OMA and the CMA, have all issued statements in support of conscience rights for doctors. I thank you for the opportunity to address the Standing Committee today about Bill 84 and implore that an amendment be added to this bill to protect conscience rights for physicians and not enforce that doctors must provide mandatory effective referrals for MAID services. I have been a doctor in Ontario since 1991. I have a large and varied practice, and I care for patients from newborn to close to 100 years of age. I have patients who are transgender, refugees, mentally ill, unemployed, and from many other disadvantaged groups. I take on all new patients who come to me for care, regardless of their gender, sexuality, religion, race, or income. And while I do not screen patients for their beliefs, I find it a regular occurrence to find myself screened by patients before they decide whether to accept me as their doctor. Patients ask me very frank questions about my beliefs. I have been asked, if my children were in charge of my care and they wanted to end my life, what would you do? And more poignantly, if one day there are no Catholic doctors, who will take care of me? Healthcare professionals and legislators alike will agree that medical assistance in death is an issue that elicits passionate opinions that range from enthusiastic support to adamant refusal to participate. And emotions on this topic are as passionate as they are because this issue forces us to face some of the most fundamental questions of life. How do we meet the end of life? How do we respect the wishes of the one we are caring for? Is it ever right to end a life? This is neither the time nor place to examine these questions, but we must recognize that the yardstick by which we each determine our answers to these questions is as different for each one of us, given our broad multicultural fabric. For many of us in medicine, it is the Hippocratic Oath we took on our graduation day, because it is not just a tradition to follow, but it is also a guiding map upon which we could build careers of honor, integrity, and service to others. These words echo to us still. Most especially must I tread with care in matters of life and death. Above all, I must not play at God. The Geneva Declaration of the World Medical Association was written in the aftermath of World War II and the shocking Nuremberg trials, which showed the disastrous consequences of medicine practice without a moral compass. The Declaration states, I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will maintain the utmost respect for human life. But what is the big deal, many say? The law is not forcing any objecting physician to perform an active MAID procedure. The CPSO is simply saying you must do an effective referral for it, as for anything else. The reason we cannot brush this off as inconsequential is because effective referral is collaborating. It is assisting and allowing an action to occur. In the eyes of the law, assisting or permitting a crime to happen itself is a crime. Likewise, forcing me to participate in arranging for a MAID consultation opposes every fundamental belief I hold about my sacred duty to always act in the best interest of my patient. It forces me to choose between breaking my Hippocratic Oath or breaking the law. It forces me to choose between facing the disciplinary committee of the CPSO or facing the judgment of God. It forces me to choose between my career or my conscience. Freedom of conscience, and by that I mean not just the freedom to hold a certain belief, but most importantly the freedom to avoid punishment for holding a certain belief, is a fundamental human right. It is the hallmark of what makes a society just and good. It is enshrined in the Canadian Charter of Rights and Freedoms, and in fact is granted the privilege of being the first right that is mentioned. Everyone has the following fundamental freedoms: freedom of conscience and religion, freedom of thought, belief, opinion, and expression. Canada has always been a land of tolerance, so it is difficult for me to even believe that today in 2017, a group of citizens must come forward and plead the Parliament of Ontario for protection of our most fundamental right as Canadians. It does not have to be this way. When abortion became legalized in Canada, clinics were set up to allow patients direct access to it, precisely for the reason that conscientious objectors would impede patients requesting abortion. Now, as we see MAID legislation take effect in many countries of Europe and Canada, we see the same framework being constructed. Access is more consistent if physician referral is removed from the equation. A direct telehealth initiative will remove barriers to patient access and protect the conscience rights of physicians. It will strike the perfect balance of rights and freedoms as envisioned by Justin Trudeau when he said, "My idea of freedom is that we should protect the rights of people to believe what their conscience dictates, but fight equally hard to protect people from having the beliefs of others imposed upon them." All of the doctors who have appeared before you share one thing in common, and that is that we went into medicine to serve people. I have given 27 years of my life to the service of others. It is hard for me to convey the discouragement I feel, knowing I may soon have to make a heartbreaking choice between my conscience or my patients. I therefore beg that this issue demands urgent attention. Protecting the conscience rights of physicians is not a Catholic, Christian, or even a pro-life issue. It is rather a fundamental human rights issue. We stand on the brink of becoming the first jurisdiction in the democratic world to see a group of individuals without conscience protection. The Charter of Rights and Freedoms must not apply to most Canadians, but must apply to all Canadians. I therefore ask today on behalf of all the doctors of Ontario that our charter rights be respected and reinforced by an amendment to Bill 84. Thank you very much for your time today.